All right, guys, welcome back. The NCLEX question of the day is going to be dealing with heart attacks in lidocaine. All right, guys, so before we get started, let me just show you a few things. So if you like what you see, click the subscribe and the like button down below. And to see more, click on more and go down to the NCLEX playlist, where you have access to all the NCLEX style questions and question reviews that I have done to date. All right, hope that helps. So Nurse Labs has an excellent array of questions for the NCLEX. So you can scan the QR code or click the link that I'll put in the descriptions to take you to Nurse Labs. And here's the question. The nurse is caring for a 65-year-old male client with a history of ischemic heart disease who's been admitted to the ICU following a myocardial infarction. The client is currently receiving lidocaine IV to manage his ventricular ectopy, which has been persistent. Which of the following factors would be the most important for the nurse to consider in relationship to the administration of this medication? Is it A, decrease in arterial oxygen saturation when measured by a pulse ox? B, increased systemic blood pressure? Presence of PVCs on a cardiac monitor? D, an increase in intracranial pressure? E, a drop in serum potassium as indicated in the latest lab results? Or F, the observation of a widening QRS complex on the EKG? So when I see a question like this, that's a whole lot of words. And so I like to break down, what do I actually need to know? What do I want to pay attention to? Well, it's important that they're in the ICU. That's going to affect the risk. It's important they've had a heart attack. That's what's wrong with them. And then I'm using lidocaine to deal with these ectopic or out of place rhythms coming from the ventricles. And that it's persistent. It's not like, hey, it happened 3 days ago. No, it's still going on. And I want to know what's the most important thing to think about with medication. So I rephrased the question, got rid of all the fluff. Your patient's in the ICU following a heart attack. They're on lidocaine for persistent ventricular ectopy. What is the most important thing to consider about the medication? That's a lot easier for me to keep track of in my brain. So the question's kind of getting at, what do you know about lidocaine? And so are we going to monitor a decrease in arterial oxygen level by pulse ox? So does having a low oxygen level make lidocaine less safe? Does it make it less effective, or is lidocaine likely to cause those things? All right, so what we find is that as your oxygen level drops, your heart's more likely to come up with these crazy rhythms, but lidocaine doesn't cause that. Matter of fact, if you take, let's say you're undergoing surgery, they knock you out with propofol, if you get lidocaine on board, it will cut the risk of having these desaturations roughly in half, from 39% to 22%. So it doesn't seem like lidocaine is going to cause this desaturation. So we can cut this off. So the next one was an increase in systolic blood pressure. Once again, lidocaine isn't really going to have an effect on your systolic blood pressure. So we can get rid of this option as well. So then our next option is the presence of premature ventricular contractions, PVCs, on the cardiac monitor. That's extremely important. Why? Cardiac death. I'm having a heart attack. I fall over dead. 20% of the time in the first month is because my heart starts quivering. It has this crazy electrical rhythm. And those are extremely common in the first 48 hours after a heart attack. And so I don't want to fall over dead because the bottom part of my heart, instead of pumping blood, was quivering. Well, how do I treat that? Lidocaine. And so we want to know whether or not our lidocaine is working, right? If I'm taking lidocaine and I still have tons and tons of PVCs, that's a major risk factor for my heart just quivering, going to VTAC, VFib. And so I might need to use more lidocaine or do something different, because what I'm doing isn't working. So what about my next option, increase intracranial pressure? Lidocaine doesn't really do that. So I'm not going to monitor lidocaine for that. Next option is a drop in serum potassium level as indicated in the latest labs. All right, lidocaine doesn't really affect potassium. And when it does, it's more likely to make your potassium level go up instead of down. Now, lower potassium levels do affect the lidocaine, makes it a little bit less effective. But as I said, it's not going to be a monster change in things. So really not the greatest answer here. So our next option is observation of a widening QRS complex on the EKG. It did not say the observation of a wide complex QRS on the EKG. Why? So wide complex QRSs, right? That's a premature ventricular complex, or that's a VTAC, or that sort of thing. And that is what lidocaine is used to treat and prevent. But anyways, lidocaine does not narrow the QRS complexes, right? So it's not going to be dealing with that. Now, in the presence of a heart attack, yes, your QRS complex can widen because you're developing a bundle branch block. But, once again, lidocaine isn't going to narrow it. And the question is asking about lidocaine. So now that I've gone through all my options, it's pretty clear that C is the best choice. Why? Because if I've had a heart attack, what's going to kill me is those crazy electrical rhythms. And that is what I use lidocaine to stop. Right? It's not going to change the width of the QRS. It's not really going to change the potassium, intracranial pressure, blood pressure, or oxygen level. And that is why I'm going with C.